I wasn't expecting this. Falling in love with you. Out of the blue, you stole my heart. You know that big tune? Bullseye, you hit me. Oh, come on. Hello, good evening. This is Dr. Kevin Ferreira with my nurse practitioner, Shannon Lindner, and here with our patient, Heather. We are coming from the Roots Wellness and Aesthetics in Little Chute, Wisconsin.
This is Heather's place. And Heather's going to get some work done with us today.
We're going to do a consult today.
When we do a consult, we just kind of start and ask what bothers them the most. So Heather, what bothers you the most?
I don't like how I'm saggy.
Okay, so, I mean, this is a very common issue for women our age. So we see in our 40s, we lose a lot of collagen, elasticity in this area. They call it the jowls, and sometimes they call it these marionette lines. And then also, not in Heather's case, but in many cases, rapid weight loss can do this to faces. And so there's lots of modalities that we have that can help with this.
Yes, usually we do a multimodal approach to patients like Heather. We can use volume replacement. With volume replacement, we like to do the more natural looking modalities. We love sculpture and also PRF gel here.
As well as with our PRF injections with the gel, that's the same place we're putting those injections. So we can go under the eye. Some places that you can't go with hyaluronic acid fillers are not good to go up in here. Like when you see that, that's not a place, it's very dangerous to put HA fillers in there.
And Shannon is right, because with MRI and other imaging modalities, you can see that it can get in the globe of the eye and cause problems.
Some places that you can't go with fillers, we're able to reach with the gel very safely and effectively.
So would that take care of the under eye?
Yeah, so under eye is very thin, but we're able to go up there with PRF gel and then, resurfacing over the top to help build collagen, because it's the thin skin and the reflection of the light that makes that look dark like that. So building that skin right there is collagen is what is going to make that go away.
We can also fill the mid-face with hyaluronic acid fillers. We can use PDO threads to pull up the skin. PDO stands for Polydioxanone. It's a synthetic suture material that goes under the skin and dissolves over 4 to 6 months, and it is replaced by collagen. We do deep threads and superficial threads to help build volume. Usually the deeper threads are molded. Those are the lifting threads. We use that to pull up skin. Also, we use the superficial thread for volume just below the epidermis in the dermal area. We also have the patient observe some great skincare. For us, we like the ZO products, and that really polishes our look.
Taking a good collagen is very important.
And IV vitamin C.
Yeah. We also do a product called SOMI, where we take some PRP from your blood sample, and then we're able to use it for 90 days going forward after a procedure, which is something that's a little bit newer that we're doing.
So a client like Heather right now, usually even when we have some deficiencies in the lower face, we always fix the mid-face first. So we concentrate on putting volume here in the mid-face, okay? And the mid-face will pull the jowls up a little bit, and then we go from there and reassess and see where we want to put some delicately placed threads. She's opted for the PRF gel for more volume because she wants a natural look, and we'll do that today. We'll also give her some PDO threads to pull up some skin.
For her, the biggest things are going to be ice and keep her head up tonight. For the first 48 hours, we're always icing and elevating to prevent swelling and bruising. And then she's going to want to make sure that her head stays in that upright position on her pillow. Laying over on the sides is going to affect and push around PRF gel the same way it does with HA fillers or anything else you use. So it's very important to lay on your back with sleeping.
One of the most important things for all aesthetic clients, we need to have a plan, because aesthetic care is not a one and done type care. It's a maintenance that we have to use, that we have to do over time. A concise, clear plan is always needed for patients like this. Some people come to the office and think that we can just do one procedure and that fix everything, and that's nearly impossible to do. We use multiple modalities, and we plan the care over time, and this including living a healthy life and giving your body the building blocks to really look and feel better.
I agree. It's getting your mindset into the idea that managing your skin and your health is a maintenance thing. And so if you start aesthetics, it's not just about Botox and HA fillers. You have to get a mindset about that will fix, your forehead. But over time, everything's not going to be congruent looking down at you. So if you want to really maintain a look and that's your goal, then you have to have the commitment going forward with the post-care number one to complete the looks, and then keep in mind that it's, ongoing. And the more you take care of it, the less you're going to have to do.
And we have all seen the patients with the incongruent look, 50-year-old face with a 72-year-old neck. And, that's not what we're going for.
Look, so, it's a commitment and that's what we're kind of talking about.
Yeah.
So the gel that you were talking that you can use up to 90 days.
Oh, yeah, the Somi.
So what is that?
Oh, that's an excellent question. Somi is a new product we use to actually store PRP and keep PRP viable for up to 90 days after we pull it. So we would use the PRP as a serum for the face. So we do it with a procedure, and then the client would have that Somi to bring home to apply to the face like every day.
A normal beauty product?
Yes.
It goes into a normal beauty product, and it's preserved for the 90 days, and you put it on like a serum.
That's awesome. What does that do for the skin?
Well, it gives you the PRP as a serum for 90-day treatment post.
PRP is one of the factors we use to stimulate healing and growth. So we do it for wound healing, we do it for joints, we do it for tendonitis, we do genital rejuvenation with PRP and
it's
PRF.
Basically like
yes.
treating it from the inside and the outside.
Yeah.
Yes.
Okay.
Yes. The Somi, we usually store it on the fridge. That's one thing. And you just squirt some off and rub it back on and put it back in the fridge, and it lasts up to 90 days. We have Somi at WOW. We have it available. We use it for all different conditions. So after we finish our consult, we take some pictures, and then we prepare the client for some more work. Let's go get this procedure done. Wow, stress ball. Great for relieving anxiety.
Yeah.
I'm gonna need 20 of them.
Oh, yeah.
There you go. Small probe.
He's funny today, so.
Funny, weird, or funny?
like funny, haha.
Funny, haha, funny. That kind of funny.
He was thinking of doing something before.
We're separating the blood components, and then we're going to use two different pieces because we're going to heat one up to albumin, and then we're going to use the PRF spin that we do second and mix them together to create a more dense material to go back into her face.
Where's the mixer?
Now we just wait for this spin.
Liquid gold. You made a lot. Hi, how are you doing?
Good, how are you?
Doing well. Yeah, we can just talk. Alright, we're just gonna do your mid-face first. So this is small poke here, lovely. 1, 2, 3, small poke. You good? You good? You good? Right down to the bone.
This is usually
good.
pretty tolerable.
I don't wanna be anything other than what I've been trying to be lately.
Like
1, 2, 3. This is the sweet spot here. You're good. You're good. You've been taking that collagen, huh? Thank you. So this fills your face better than the PRF alone. Look at this to that. Oh.
Holy.
You're good. You're good. I'll take off all of that with the CO2 laser. Make it look 10 again.
She's doing great.
It's either that or plastic surgery.
Small poke. Give me something to bore a hole, Shan.
Bore a hole.
Yeah.
There.
Oh yeah, there you
That feels
go.
great, yes.
And I'm gonna just do a back shot here.
And then go in the same hole. Superior. I like this beautiful.
Sorry, love. No. Small poke. Sorry, love. Sorry, love. You're doing good. Look at here. One more band here. One band. Ah, there you go. Excellent so far. We're trying to break some bands underneath the skin. Those bands are what we get when we age. When we lose collagen, the dermis and the epidermis, we get a little scarring bands in between the area. We're gonna put a PDO thread. This is a molded thread, 18 gauge, 100 millimeter. Lift the skin up and build collagen. So let's fix it.
Somebody hear him, let me massage your face.
That's not this. We're not massaging, we're getting the thread to fix. The threads are synthetic suture material that dissolves in the body over 4 to 6 months. When it's dissolved, it's replaced by collagen, okay? And that's what we want. Is a loss of collagen equals loss of volume. Loss of collagen and loss of elastin in the dermal area means loss of volume, okay? So the more collagen we can put in is the better volumize our face would look. This is collagen induction therapy. We use the body's own collagen to make volume, as opposed to the hyaluronic acid fillers where we use fillers just to make volume, you know. So that gives a more unnatural look. We get a more natural look with this at the end. So you see we fill our mid-face, lift our face up a little bit, and then we fill here.
We're gonna just kind of like do this motion.
How often?
I think
5 times a day. So we want to massage up 5 times a day, 5 times in every area for 5 minutes. So it's 5, 5, 5, just like what we would do with sculpture. You massage 5 times a day for 5 minutes.
For how long?
For the next week or 2. Good question. This is Kevin Ferreira and this is Shannon Lindner. Don't forget, we meet you where you're at.